My name is Teresa Miller, and I'm proud to serve as the Secretary of the Pennsylvania Department of Human Services. May is Mental Health Awareness Month, and traditionally we've held an event in the Capitol building to mark this month. This year is much different, but I'm grateful to have the opportunity to virtually highlight Mental Health Awareness Month. Too many people struggle with mental health issues in silence. Mental illness is not always visible, but it affects Pennsylvanians of all ages, races, ethnicities, and income levels. And only about half of people impacted by mental illness seek treatment. The purpose of Mental Health Awareness Month is to raise awareness and understanding and to fight stigma of mental illness and substance use disorders. The first step in doing that is being upfront about the difficulties we're facing. I know many are struggling with anxiety and other challenging emotions due to the COVID-19 emergency. It's not unusual for people to feel anxious, alone, and frightened, and for some, those feelings may be surfacing for the first time during this pandemic. We're worrying about our parents, our children, our loved ones. We may be or feel more removed from our social networks. And the indefinite nature of this pandemic is likely creating more anxiety. These feelings of fear and anxiety are completely understandable. It's normal to feel this way, and that's okay. I hope you will take time during this Mental Health Awareness Month to pay attention to your own mental health. This crisis may not always allow us to tune in to our personal needs, but you must take care of yourself in order to have the ability and emotional capacity to take care of others. Be careful about how much information you're exposing yourself to. It's okay to tune out and not follow constant news coverage. Be sure to make note of changes in sleeping patterns, the amount of time spent on focusing on the crisis, or your use of alcohol. Find ways to connect to people who are supportive and know that physical isolation does not mean social isolation. And most importantly, if you find that you may need help, reach out. You're not alone. The Department of Human Services is here to help if you need it. This public health crisis will not stop the work of providing support for people who need an extra hand, both during the pandemic and after it's ended. We have a statewide support and referral helpline for Pennsylvanians struggling with anxiety and other challenging emotions due to the COVID-19 emergency. This helpline will refer you to the community-based resources that can further help to meet individual needs. The number to call is 1-855-284-2494. For TTY, dial 724-631-5600. Since its launch at the beginning of April of this year, the helpline has connected more than 3,000 Pennsylvanians with a line of support to resources they may need. You can find other mental health resources on our website at www.dhs.pa.gov. Though we may be social distancing, we can all make a difference in this unprecedented time. Speak out against the stigma of behavioral health disorders that challenge individuals from seeking the treatment they need. Find ways to connect to people who are supportive, like friends and family. Check in with friends and loved ones who may be isolating alone. And always be sure to focus on your mental health. If you need it, help and support is always available. Thank you.